Good afternoon and welcome all. Very exciting that today's the day. It's great to be together virtually as much as ever with all of you, with our tremendous roster of speakers, and really just with so many colleagues from diverse areas of interest, sectors, backgrounds. My name is Mark Garevich, and it's really a pleasure to welcome you on behalf of the Department of Population Health at NYU Langone Health to the first of two virtual sessions for our 5th annual Health and Conference. Our conference theme this year is Health and Social Connectedness. Today, we focus attention on social movements and social connectedness. In our second 2-hour session on Monday, November 16th, we'll focus on social connectedness in the context of crisis. So as a Department of Population Health in a medical school, we bring a particular perspective in framing the agenda of these conferences. We look at the world through a lens of total population health. Importantly, this is not the same as the version of population health that's limited to the patients of a healthcare delivery system. For while healthcare, of course, contributes importantly to population health, the health of a community, a neighborhood, a city, is really the product of a far broader web of determinants and drivers. And so we chose the title of our department's annual conference to be Health and, to illustrate that point. In past years, we focused on health and place healthcare and education, health and racial equity and urban well-being, health and data science and public action, and last year, health and childhood and opportunity. This year, we're focusing on an area of it that gets really right at the heart of things, health and social connectedness. So the backstory to our settling on this theme really began early last fall, in the fall of 2019, when we began planning our 5th annual Health and Conference. Although there were other contenders, we almost immediately reached consensus on the theme of health and social connectedness. We began to invite speakers, a number of whom are here today or participating in part 2 of the conference coming up in November. But then along arrives COVID. So it's really in late February and early March, as everyone began to reassess the safety of attending conferences, we initially actually considered skipping a year. But another month or so passed, and then the obvious hit us, really that the theme we are focusing on, social connectedness, was basically at the very marrow of what COVID so profoundly disrupts. I know there's not a single one of us here today who hasn't personally felt the virus's assault on that most fundamental of human needs, social connectedness. So we knew we had to go forward. Hardly, though, was the reality of COVID setting in when the murder of George Floyd, Ahmaud Arbery, Breonna Taylor, Rayshard Brooks, and so many others unleashed an outpouring of protest in our communities across the country, really giving witness, even against the backdrop of COVID, to another kind of social connectedness, of social movement and mobilization and solidarity, aimed in part at addressing some of the very forces that have persistently threatened community resilience and connectedness, particularly in communities of color. So in short, the relationship of social connectedness and health was just swirling all around and really anchoring our sense of purpose in planning this conference and in bringing us all together today, and then again in 4 weeks from now, to consider together the many facets of this complex issue. In short, this year's Health and Conference really asks the question, how can we do better in fostering social connectedness, both for its essential human value and reflecting our goal of improving health and health equity at the population level? This goal is really at the core mission of the Department of Population Health here at NYU Langone. And so it is that we count ourselves fortunate in being joined today by really just some of the most outstanding thought leaders in the field, policymakers, academic researchers, advocates, community leaders, to help us sharpen our thinking, our research agendas, and our strategies for action on the connection of health and social connectedness. So I'm just going to briefly outline the arc of today's 2-hour convening so you can follow its progression more clearly. Today's keynote speaker, Zach Norris, whom I'll introduce more fully in a moment, will address the role of social movements in bridging divides and building relationships to achieve just and inclusive communities and a culture of care. His talk will be followed by a panel of leaders in community advocacy and coalition building to discuss their thoughts on social movements and social connectedness, moderated by Dr. Joe Ravenel, a faculty member in our department and Associate Dean for Diversity Affairs and Inclusion here at NYU Langone. Joe will introduce our panelists in detail later. Now, there are many people to thank for our meeting today, and I'll do that at the end, but except for really just one, my colleague Lorna Thorpe, who in addition to leading our Division of Epidemiology and serving as Vice Chair for Strategy and Planning in our department, has truly been the architect and driving force behind the set of conversations that are about to unfold. So strong thanks, Lorna. We encourage you also to sign up for the second part of the 2020 Health and Conference that's taking place on November 16th. The theme of that, in alignment with today's program, will be social connectedness and resilience in the context of crisis, something we've all been grappling with really since the pandemic began. We have a terrific keynote address planned from Dr. Eric Kleinenberg about the sociology of connection, and a panel then on public policy initiatives to build social connectedness, featuring a conversation between our city's new health commissioner, Dr. Dave Choksi, and Shirley Franklin, former mayor of Atlanta and executive board chair of Purpose-Built Communities. All of this moderated by Dr. Doug Judy, executive director of the Build Healthy Places Network. All right, so onward to today's event. For our keynote, we're just extremely fortunate to have with us Zach Norris, executive director of the Ella Baker Center for Human Rights, based in Oakland, California. Mr. Norris recently authored a book entitled We Keep Us Safe, Building Secure, Just, and Inclusive Communities, which came out in February of this year, just before the pandemic hit. He is also the co-founder of Restore Oakland, which is a community advocacy and training center aimed at empowering Bay Area community members to transform local economic and justice systems and make a safe and secure future. Zach's a lawyer who trained here at NYU after attending Harvard for his undergraduate degree. And among the many efforts he's led to address criminal justice reform, Zach helped build California's first statewide network for families of incarcerated youth, which led the effort to close 5 youth prisons in the state. So without further ado, it's really a great pleasure to pass the mic to our keynote speaker, Zach Norris.
Thank you, Mark. I really appreciate it. And thank you, Lorna, as well. This is an amazing opportunity. I don't think you could have picked a better topic for this year, as you were saying. And so I'm just going to acknowledge that I was not born into technology as my kids were. So I'm hoping that you are seeing the first slide now. Okay, great. So I just want to start with a couple of breaths, an in breath and an out breath. These are anxious times, and these are times when we don't necessarily feel as safe as we should. And so I like to just start by asking everybody to take a breath in and take a breath out. Take a breath in. Take a breath out. I live in the Bay Area, and there was one day when we woke up and the sky was absolutely yellow. And it was like it was nighttime during the entire day. Hearing stories of people fleeing their homes, acknowledging that there is a very important election just a couple of weeks away, acknowledging that ongoing state violence in this country is not a pandemic, it is endemic to our society, and it has been there since the beginning of these United States. And many of us have kids at home who we are trying unsuccessfully to get them on their Zoom calls while we're trying to get on our own Zoom calls. It can be stressful. I feel fortunate that we have, internet bandwidth sufficient for me to be able to speak to you while they're also doing their studies. So trying to be grateful for the things we have and trying in these anxious times to remember that we can get to safety. And so one of the things that I will ask you all to do with me now, you can put it in the chat as a Q&A, but it's more of a comment, is if you could think of a time when you felt safe, and really just take a moment to bring yourself, and it could be now, could be where you're at sitting at this moment, or it could be a particular time when you felt safe. What were the conditions surrounding you? Um, what was happening? Who was there maybe? Um, and I'm not going to ask to bring that into the conversation just yet. I'd like to just kind of let it marinate for you, but really think about it. So I'm going to be quiet for a sec. So as Mark mentioned, I get to run this incredible organization called the Ella Baker Center for Human Rights. It was founded by Van Jones and Diana Frappier in 1996. We have been around for almost 25 years, and we try to build on the amazing legacy of Ella Baker. Ella Baker was a brilliant Black woman, a leader in decades of struggle for freedom for Black folks and for all folks in this country and in this world. And she believed in the power of everyday people to make change. So she organized with students and sharecroppers alike. She didn't suffer fools lightly. I think I'm getting that phrase right. She was able to really stand up to men within the civil rights movement and the freedom movements to demand a space and a place and power and agency for Black women within the freedom movements. And we try to build on her legacy by advancing what we call a books, not bars, jobs, not jails, healthcare and housing, not handcuffs agenda. So we really like alliteration, and we also really like social justice. We believe that it is necessary for us to move away from what I describe in the book as a framework of fear and to move towards a real culture of care. And so that resource shift is really designed to move our country in that direction. And speaking about health and health frameworks, what we say is that public safety starts with public health, that there are a number of issues from drug use and abuse to mental health to school discipline to violence even that should be dealt with a public health approach. Um, and, I never thought that we would need to say that a global pandemic also needs to be dealt with via a public health approach. But there are those who would use even a global pandemic to run the same framework of fear playbook that says, it's those folks' fault. And I'll talk more about that. But we now see that even in the context of a global pandemic, we need to remind people, hey, there is a public health solution to this public health issue. Now, I wasn't thinking about public health issues or, uh, any of these things when I was growing up in Oakland, California. This is the way I think of Oakland. It is a beautiful city. There's a jewel in the center of it that we call Lake Merritt. I grew up born in San Francisco, moved to Oakland when I was a week old. I like to say it was a week too late just because I love Oakland that much. But even, the things that are shiny or seem to be beautiful as this picture portrays have their underside. So Lake Merritt is actually only really 3 feet deep, and it's, a dammed lake. It's really a saltwater marsh. It's not, it's the largest urban saltwater marsh in the country or something. It's like, there are like 10 qualifiers before it's the largest anything, but these are things that I learned as I grew up, and my perception of my city changed as I started to understand what was really happening around me. And part of that was because I was in this womb of connection all of the time growing up. So I had an older brother and an older sister. My mom and dad were there. They were divorced, but very much supportive of me. My mom drove me to Catholic school every day, scraped and saved to send me to Catholic school. She drove me in this big green tank-like Volvo in the 80s. If you remember those Volvos that look like literal tanks, right? I did well in school. I ended up going to Harvard as an undergrad. And that was when I started to notice some things, both about what was happening at Harvard, but also about what was happening in my community in East Oakland. I started to see that, young people are treated differently, often for doing some of the same things. So, a kid who got involved in a fight at the gymnasium, young people who were using and abusing drugs at Harvard were given the support and services, mental health counseling, worst case scenario, maybe a semester off. It was always clear that they were more than their worst mistake. And young people in my community were getting locked up, were losing years and months of their lives for doing similar things. And that disparity, understanding some of those disparities were kind of an eye-opening experience for me. And then seeing my mom transition from teaching in Catholic schools to teaching in Oakland public schools, seeing my dad get laid off after working 18 years at a shipyard company, all started to change my perception of where I was growing up and what I needed to be doing in the world. And it also started to lead me to question, just the United States in and of itself, because in school we're taught that we're the global leaders and we are leaders in democracy. And I was starting to see that we are leaders in other areas as well, that we have 4% of the world's population, but 25% of the world's incarcerated people, right? We have 4% of the world's population, but produce 25% of the world's CO2 emissions and carbon emissions. And there is this way in which we have treated people and the planet as disposable. And that is reflected in some of what we're seeing with COVID-19, where we have nearly 25%, I think it is, of the world's COVID deaths. And nearly half of US children have a parent with a criminal record. And so some of what I was seeing was the erosion of some of the supports that were developing in the years and decades before I was born. So I was born in 1977. And the late 70s, as you all know, was an era of economic stagflation or something they called it, right? It was not good times economically. And folks were trying to figure out, how do we get out of this? And in California, there was a union, the California Corrections Peace Officers Association, who said, I know what we can do with the state surplus. We know how we can actually create jobs and create infrastructure. We have a plan, and we are going to solve crime, and we are also going to build infrastructure in the state. And Ruthie Wilson Gilmore, professor, wrote a book called Golden Gulag that really describes this dynamic. And from 1980 to 2016, we built 23 new prisons in the state of California and just one new university. And there was this dynamic where the prison guard union was saying, if you build more prisons, we'll increase infrastructure. But then as they built more prisons, they also began to fill those prisons, which created new jobs for um, prison guards, which then created more capacity to lobby legislators to change more laws. And you see the sort of negative and vicious cycle that was created during that time period. And I have a number of folks who work in various capacities within law enforcement and within prisons as family members who are, near and dear to my heart. But I think what we have seen is that we have grown exponentially in terms of this framework of fear and supporting things that actually accelerate the morbidity and mortality of people of color and poor people. And one of those areas is our budget in terms of the military, that 53 cents of every federal dollar goes to the military. And you can see this brightly colored array of things that get a much smaller amount of resources. We've seen the number of people incarcerated grow to nearly 2.5 million inside of the United States during that same period that I described from 1980 to now. The lion's share of of city budgets go to policing. And you can see some of the increases during that same time period in California, in Alameda County, which is home to Oakland and Berkeley, and at the city level as well. And these are dynamics that have been what I call recession proof, right? So even as from 1980 to now, cuts were made to housing, to education, to healthcare. The two things that have been recession proof have been policing and prisons. And so those are things that, again, have accelerated the morbidity and mortality of Black and Brown people. And as Reverend William Barber describes, that doesn't even account for the sort of death measures on the down low, as he calls them. And those are the deaths associated with a lack of health care and housing, that for every, I think it's 500,000 people who don't have health care, 1,800 people will die. I need to look up that statistic. That, some 700 people a day die of poverty. And these were pre-COVID statistics that I'm describing. And what I want to name is, and something that I really grappled with in the book, is how is it that crime, by and large, over the last decade, has been at historic lows. And there's been some uptick in particular areas, but by and large has been at historic lows. And yet our anxieties have been at historic highs. And there are two things that I want to name that I think help to explain this dynamic. One is that crime is an inadequate measure of harm. So that there is this circle of crime that gets focused on, but there's this larger circle of harm. And there's certainly a Venn diagram and an overlap between crime and harm. But there's a way in which our criminal court system has focused on crime in the streets while often neglecting crime in the suites of power, has focused on crime on the corners while often neglecting and not focusing on crime in corner offices. And so the decisions by Big Pharma and the decisions by the FDA that have washed have flooded communities with opiates, have been under scrutinized and not really held accountable in terms of the amount of death that they have caused across the country, as just one example. And the other dynamic that I want to name is that there are these architects of anxiety in our society. And these architects of anxiety, as I alluded to when I started, tend to focus our attention on scapegoats. So rather than acknowledging the public health crisis that is COVID, they may say, blame China. Rather than actually focusing on rising inequality, focusing on the harms associated with climate change, they blame the folks that are effectively our neighbors. And I believe that these architects of anxiety are engaging in a lie. It is the same lie that abusers tell. Abusers often say, don't trust those who are closest to you, right? They say, don't trust your neighbor, don't trust your friend, your girlfriend, don't trust your mother, only trust me, even as they are often causing the harm inside of that home. And similarly, our president has engaged in a similar lie. he has said, don't trust your neighbor around the block, don't trust your neighbor at the border, don't trust your neighbor in distant lands, only trust me. Meanwhile, the harms associated with inequality, with climate change continue to grow and continue to go unaddressed. And so I call this lie the he keeps us safe lie. It is the lie that abusers use, and I believe it is the lie that is fundamentally undemocratic, because when you are naming and shaming entire communities and saying these folks are to blame, it becomes easy to not just say they're incapable of redemption or rehabilitation, but also that they don't deserve the vote, that they aren't part of the circle of human concern. And so when we talk about connectedness, I think we have to really address this us versus them dynamic that has been intentionally stoked, and really acknowledge that it is we that keeps us safe, and that we have an opportunity to build public systems that really acknowledge our interdependence. Because if COVID has done anything, it has really exposed the way in which um, that our safety is tied to one another. As Van Jones has said, if you don't solve COVID inside of prisons, how can you expect to solve it outside of prisons? If you don't solve it in those meat packing plants and elder communities, if you don't solve this public health crisis in the context of some of our most vulnerable communities, you can't expect to solve it more broadly. Um, so I would ask that you all take another breath, because that is a lot to hold. And we are going to come back to that time when you felt safe. Um, so if you remember, and I can't see the chat, so what I will do is just raise a time that I felt safe. I think about my grandmother and the way in which my grandmother held my hands, and just being around her. She had this way of holding my hands that were like not just a single hand holding my hand, but she would hold my hand with both of her hands. And one hand was just holding my little hand, and the other hand was kind of gently tapping my fingers. And to me, it was this reminder that she was there for me. And it was also this reminder that she had my back even when I made mistakes. Um, and I think we've developed this idea that accountability is about punishing and punishment. Punishment equals accountability. But I would submit to you that nothing could be further from the truth. That accountability is fundamentally about relationship, because accountability requires that you acknowledge the harm that you have caused, which means really understanding from the perspective of the person who you've caused harm, like what happened, what did I do? And then secondly, that you make amends for that harm. And um, what we really do with punishment is we add damage to damage, we add harm to harm, and we create an adversarial system that separates the person who's caused harm and the person who's been harmed in an adversarial court dynamic. And um, that process doesn't give a lot of agency to the person who's been harmed, doesn't give a lot of agency to the broader community. And I'll explain more about what I mean by that. But just want to summarize that accountability does not equal punishment. Punishment is actually harming someone who has caused harm. Accountability is about acknowledgement and consequences, and both require a relationship. Or to say it another way, both require connectedness, to know the harm you have caused and to do your best to repair it. And what we found in doing community-driven research across the country with 20 other community-based organizations is that when we send someone through the criminal court system, the person who's caused harm, to supposedly hold them accountable, we are not only impacting them, we are impacting their entire family and their entire community. We found that families were spending on average $13,000 per year to support their loved ones inside of prisons across the country. We found that 2 out of 3 families were facing the difficult choice between paying for basic necessities like food and supporting their loved ones inside. We found that um, families were the #1 reentry support for people coming out of the prison system. And we aren't supporting families by sending their loved ones through the criminal court system. There is a better way to um, to do this work, and that is partially about really investing in restorative justice. It is about actually holding people accountable while still holding them in community. Restorative justice is an amazing process. It is has been around for generations upon generations. Indigenous people have used a form of restorative justice for eons. And basically, rather than separating the person who's caused harm and the person who's been harmed, those folks are brought together in a voluntary process on both parties' side, on the part of both parties, and they are surrounded by a community, the folks that support them. An accountability process is developed so that the person can see the harm that they have caused. Know that, I snatched this person's purse, I knocked them down, they are still having nightmares, they are still dealing with injuries associated with the harm that I have caused. And also then be connected to a plan to actually make amends for the harm that they have caused. And this process of restorative justice actually works. It works for the person who has caused harm. Um, they are much less likely to recidivate or get back in trouble again, having gone through a restorative justice process. It also works for the person who's been harmed. Victims report much higher satisfaction rates in going through a restorative justice process because they can see the accountability, they can feel the accountability that has happened. And lastly, it works for that whole circle that is surrounding them because everyone in that circle of support is asking themselves, what could I have done to actually prevent this harm from happening in the first place? And thinking through what is the accountability plan that needs to happen and really dealing with and grappling with some sticky situations and thorny problems. And through that, we're really building our community accountability muscle to not just hold accountable those folks on the streets or on the corners, right, as I said, but also how do we build the muscle to hold accountable people in power? Maybe it's a restaurant owner who is creating a toxic work environment, or maybe it's a city council person who has not been honest in their dealings with the community. So really creating a restorative justice process can help us build that community accountability muscle. And so I want to tell you a little bit about our work and not just talk in generalities, because after we did this community-driven research project, we were engaged in a campaign that we called the Jobs Not Jails campaign. The state of California had been sued as a result of overcrowding. They were not providing adequate health care to folks inside of prisons, and there are 100,000 plus people inside of California prisons across the state. And they had been sued at the close of the last decade, around 2010. The legislature said we are going to stop intake of people convicted of less serious, non-sexual, non-violent, non-serious offenses. Counties, 58 counties, you all should deal with these folks. Now, you might think that the counties would say, great, we have this opportunity. We are not going to repeat the mistakes of the state that led to this overcrowded crisis. Unfortunately, that isn't what happened. Most counties said, we're going to give the lion's share of these resources that are coming from the state to our sheriff and probation department. And so you'll see on the left here, we were meeting with Supervisor Wilma Chan, to encourage her to vote to move some of those resources to community-based reentry supports. Rather than giving all of those resources, we said these are folks convicted of non-serious, non-sexual, non-violent offenses. They should be great candidates for non-jail solutions. Let's actually invest in employment opportunities, housing supports, etc. We were getting the runaround, not so much from Supervisor Chan, but from some of the other supervisors. And we ended up having to do a civil disobedience. We finally convinced them to actually move resources away from the Sheriff and Probation Department and towards these community-based supports. So it was a huge victory, $10 million annually. And what we found was that there was an opportunity to really support this kind of vision of restorative justice, of economic opportunity that I described to you. But, you know, sometimes our biggest victories can also be our biggest challenges. And what we found is that even as the resources were being moved, those resources went to nonprofit organizations that were great at responding to an RFP, but not necessarily great at responding to communities. They were great at offering job training, but not really great at actually placing people in jobs. And so what we having won that victory and starting to see the way some of those resources were spent, we said everybody needs a visual aid. We have been for so long in this country thought of public safety as being associated with prison bars and guards and policing. We need to put forward a different vision of what community safety is and what it looks like. And so we decided to create an 18,000 square foot building. Well, we didn't decide to create an 18,000 square foot building, but we purchased an 18,000 square foot building and decided to create our vision of community safety within that building. And this is one of the rooms where we have created a dedicated space for restorative justice, where again, people can be held accountable and yet still held in community. It has a space that will be a restaurant run by formerly incarcerated folks and their families, a space for nonprofit organizations to do their work, right? As an organization that had been bounced around the Bay Area 9 times in our 20-year history, we really needed a home and a home base for our work, as did other nonprofit organizations. And we like to say that you can't have strong communities if you don't have strong community-centered institutions. And so we are doing a lot of different things in this space that we call Restore Oakland. We are demonstrating that restorative justice is real accountability, that restorative justice is hardcore. It is not soft or weak. It is actually really holding people accountable for the harms that they have caused. And it works in schools, in workplaces, in the home, and even at the level of nations. And we are bringing that vision together in the context of this 18,000 square foot building, which is located in one of the most diverse regions within the city of Oakland. And so I want to end by telling you a story. And I think it's a story that is really important for us in this moment. Because what I would offer is that we are in a moment when the status quo is fundamentally unsafe. Even before COVID, and even before this most recent spate of wildfires here in California, a couple of years ago or a year ago, we had a number of fires that were associated and directly tied to PG&E or Pacific Gas and Electric. And I thought to myself then, like the folks who are supposed to be providing energy infrastructure to us are actually responsible for a lot of the destruction that is happening in terms of wildfires across the state. And the only way for them at that time to really stop some of those wildfires from continuing to move forward was effectively to shut down our energy infrastructure as a whole. So I think we've reached a place in the context of the environment where people identify that fossil fuels and the way that we've done our energy infrastructure has to be wholly transformed. But I don't think that we've yet reached a place and a space where we have understood the importance of our visions of safety um, to our democracy as a whole. I don't think we've understood the way in which an over-reliance on punishment has actually made us less safe. And if we are going to move from a status quo that is predominantly unsafe, where our primary strategy to address harm is actually severing relationship, stopping connectedness, moving people to remote prisons, um, then we are not going to get to safety unless we somewhat paradoxically begin to take risks. And I want to tell you one story about a risk that the city of Richmond took. So Richmond, California had some of the highest per capita murder rates in the country. I think it was the highest per capita murder rate in the country at one point. And this was around the turn of the century. And in 2005, they held a city council meeting. The city council had already declared a state of an emergency. City council members were themselves afraid to go out at night. Folks were really up in arms about what we can do about the lack of safety in the city of Richmond. And the police had tried to make the case on about 30 mostly young people who they believed were responsible for the vast majority of the homicides in the city of Richmond. And they were holding this city council really trying to brainstorm about what could be done. Uh, Devone Bogan had worked at the Mentoring Center in Oakland and had seen some real successes with a mentorship program there. And he said to them, I want to engage these young men that the police have identified in a mentorship program. And mostly he got a lot of side eyes and skeptical looks and even some laughs and worse, as he described it to me, in that city council meeting. But, fortunately, in some ways, the city had tried everything else, and the city administrators said, we've done everything under the sun. Let's give this a shot. So the thing that was risk number one, right? Risk number two was Devone Bogan reaching out to these young men and them coming to City Hall, right? Because this was a place that was off limits, was out of bounds, law enforcement all around City Hall. But he had worked with trusted messengers in the community, had worked with formerly incarcerated folks, brought these young men to the room, the nicest room in all of Richmond City Hall, overlooking views of the bay, and said to them, every single person, has looked at you all as the problem. No one has asked you what you think the solutions are. I want to engage you in that dialogue. I want to talk with you about what can be done, about what's happening in Richmond. And here are the things that I have to offer. I want to give you a monthly stipend to support you and your family. Daily positive contact with mentors, daily mentorship, so you can check in with somebody and receive that phone call and let them know how you're doing. Someone who's been where you are. And then I want to take you to places that you haven't been and offer you travel opportunities to see beyond the confines of Richmond. And one of the things that he did was the first trips, were with, folks from the same neighborhoods. But as he offered them trips outside of California and even one outside of the country, he said, if you want to take this trip to South Africa, you have to go with folks from rival neighborhoods. And that was another risk that was overcome and taken by these young men. And as they started to see each other and be involved in these trips, The walls between them came down, and the walls in the city of Richmond came down, and um, the homicide rate in the city of Richmond dropped precipitously, some 70% over an 8-year period. And so that meant that mothers and grandmothers could take their kids to the park. It meant that shopkeepers could keep their stores open. Um, it meant, night and day difference, not just in terms of safety, but overall economic vitality in the city of Richmond. And to me, it is indicative of the kind of change that is possible. And if we can do that at the level of one city, I know that we can do that at the level of this country as well. And so I am really, um, I'm mindful of the risk that we are in this moment, but I am also present to the opportunity that is in front of us. And there have been people who have been saying, we're at the brink of a civil war in terms of the level of division and divisiveness in this society. And I don't think that that's by accident. When we design our safety systems fundamentally in ways that sever ties, that isolate, when we don't support people to have, some of the basics, food, clothes, and shelter, it really creates an isolated situation that many researchers have shown is compatible with the rise of white supremacy and other forms of divisive ideology. And so when I think about this moment that we're in and where we need to be, I think about post-World War II. And there were social movements that were pushing Eleanor Roosevelt and Franklin Delano Roosevelt, to really address the place that the country was in, and to address the place that the world was in terms of divisiveness. And so you see on the left, the end of the war, it says Nazis give up, right? And there was this push, by the president and his wife to say, how do we ensure that we never go back to this place again? Part of that was investing in this universal declaration of human rights. They also articulated it as a second Bill of Rights, that the country needed a second Bill of Rights, a right to work, a right to housing, a right to health care, a right to education, right? And I think about those things and I say, oh, books not bars, jobs not jails, healthcare and housing not handcuffs, right? Those are the same things that we are fighting for now. And I believe that we can get there. I believe that we will get past this moment of divisiveness and that we will begin to invest in the things that actually make us safe. And I know that each and every one of us is capable of taking those risks, because I believe, in the words of Ella Baker, who said, give light and people will find a way. And I know that you all are being beacons of social connectedness, that you are thinking about how we bring, communities together to ensure that people can see that light and can gravitate towards it. Because even though we are in this realm of physical distance, it doesn't mean that we can't be in social solidarity. So I just want to thank you all so much for your time, and really look forward to hearing your questions.
Zach, thank you so much. What an awesome and just deep and uh, inspiring talk. Seriously, I
Right
think
on.
from even just from opening it with breaths, to getting us to sort of center on our own uh, thoughts of safety, to then the very big vision that you present. It's really, really great to hear. Thank you so much.
Yeah, definitely.
We've got some, so we're going to open it up to some dialogue and some Q&A with you. So I'm going to encourage uh, participants to put questions out in the Q&A, and I will do my level best to to transmit them, and sort of we'll start it off that way. Let me ask you a question that was occurring to me as you were speaking, which is that there is a level of kind of profound localness to the work, really, whether in the way that you describe some of the restorative justice work, the way that the example that you gave in Richmond. There's
Mhm.
somebody who I didn't catch the name of the individual who said, "Look, let me give this a try. I'll speak to those 30
Yeah,
folks and so forth." But my guess is he was known
yeah,
and had some credibility
yeah.
already. And so, how do you um, um, mesh the localness with the idea of really trying to build a movement, or even at the national level, thinking
Yeah.
about bringing about some movement in this direction?
Right on. I really appreciate that question. So Devon Bogan is with Advance Peace. They're doing incredible violence prevention work across the country. And one of the things he lifts up is that, that program got $1 million, and a lot of the traditional law enforcement approaches gets like $60 million a year. And so we can be and should be really scaling up these community-centered interventions that have proven success. Unfortunately, too many people are invested in the status quo. And I think you're right that it does take really building from the ground up. And I want to tell a story that I think briefly illustrates that. When we started the campaign to challenge the incarceration of young people in 8 state-run youth prisons across the state of California, we would go and try to talk with families who are visiting their children.
Yeah.
And we were told that we couldn't do that at first. We had to advocate just to be there. Families were often told they couldn't even talk to each other while standing in lines to go and visit their children. They would having driven like 350 miles on average to see their kids, they would be told you can't visit because you have on the wrong color pair of pants. And so the level of isolation and the level of disconnectedness that is intentional, connected to the criminal court system, I don't think can be underestimated. But what we were able to do is like say, hey, you may not be able to talk to me now, but we're going to be at this pizza place right next to the youth prison. When you're finished, come by, have a slice of pizza with us. And we're able to just create space where people could talk to one another. The criminal court system does a great job of shaming and blaming, right? And so these were families who were dealing with their own feelings of shame, but also just deep fears because a number of young people had died inside of these institutions. And so when they were going to visit and not getting a visit, they weren't sure if it was going to be, if their past visit would be their last visit, right? And so I think that it is through rebuilding those connections. And what we were able to do is start with a handful of meetings and gatherings, a few dozen families that over time grew to over 1,000 families. And we would go to the Capitol and be persistent and really then begin to disabuse legislators of some of the mythology that was so prevalent, right? Because this is at a time when
Yeah.
a youth super predator mythology, the welfare queen mythology was still very much present in the mind of these legislators. And we know that this country has a long history of family separation that is intimately tied to racial injustice. And so that sort of remembering families and bringing them and showing the levels that families were going to just to support their children was really important. We started with the demand of closing down youth prisons. We pivoted over time and said, well, hey, can you pass this legislation to at least make it easier for families to stay in contact with one another, make it easier for them to write and phone calls, and legislators could get behind that. And then, we were able to build on that momentum to eventually get them to bring legislation to begin to close youth prisons down. And the governor just signed a piece of legislation that effectively phases out of the state-run youth prison system. So those remaining 3 youth prisons that are state-run will also be closed down over time. And so what started as like, you will never do this, this will
Yeah.
never happen, really was transformed through the practice of building community and organizing and really connecting folks first to their own like we can do this in agency, but then also beginning to challenge the perception of legislators as well.
And following on that, someone asks the question, about about people who want retribution, and I guess you could say politically or even in a community. I mean, we can all imagine people saying, "Well, no, I don't go for that."
Yeah,
There needs to be some retribution,
punishment. Yeah,
or how is that? Do you sort of just say, look, there's how do you answer?
yeah,
Yeah,
great. That's a great question. The first thing I would say is like the switch from a framework of fear to really adopting a more public health culture of care approach to safety is not an overnight switch.
right.
It doesn't happen overnight, but I think in the same way I use the analogy of fossil fuels, we need to divest over time from a fossil fuel approach and invest in a different energy infrastructure. I think similarly that we need to do that um, in the case of our public safety systems. And it was funny because I was just talking with prosecutors yesterday or the day before, a group of prosecutors who are looking at these issues and struggling with some of the same questions that I as an advocate struggle with. And and I said to them that you all are not only victim servants, you are also public servants. And you should recognize that the same folks who have um, harmed others have also themselves been harmed, right? And that, as Danielle Sered, who's in New York, has said, that runs Common Justice, violence doesn't just start out of nowhere. It is really cyclical and begins with poverty and inequity and other forms of violence and violence in the home. And so if um, we can acknowledge that not every victim is going to want to go through a restorative justice process, and restorative justice should be a voluntary process that both sides agree to. That being said, our role as public officials, and I believe that the role of prosecutors, should be to understand that in this country, there isn't a shortage of punishment and divisiveness, right? That isn't actually what's lacking in this
Yeah,
country.
right.
In this country, what is lacking is real accountability for past harms and a real fundamental reckoning with how those harms manifest in communities across the country. I don't think we would see the level of social movement and uprisings that we've had in 2020. I don't think we would see the level of, frankly, a lack of attention to how we deal with this public health crisis if there weren't the levels of divisiveness and quite frankly, self-centeredness that we've seen in this country over this year. And so I think, it's one thing to ask what victims want. It's another thing to ask, what does the public need? And I think as public officials and prosecutors included, we need to begin to understand how we shift that. So that means prosecutors taking a different tack, but it also may mean that we have to look at how prosecutors become prosecutors. So if they are elected, should they be elected? Should there be another democratic process that gives them a little bit more insulation from some of these charges of, like, this person did this harm and you let them out too soon, and
Hmm.
some of the gotcha stuff that puts prosecutors in a position where they feel like they just have to give everybody the maximum sentence possible.
And then in terms of another question sort of gets at this, you mentioned almost, I think it was like concentric circles. There's crime, there's harm, and is public safety around,
Mm,
broader than that, uh, and sort of speak maybe a little bit about if that's a framework, public safety, or what is the overarching kind of equivalent almost to public health
yeah,
in this work,
yeah,
and how do you like to name it?
yeah. So I would describe crime and harm as being um, not so much concentric, but overlapping,
Hmm. Hmm. Yes, right.
and crime being a sort of smaller subset of the harms that are not going addressed. And I think in a more rational and a more just system, harms would be addressed more broadly, and there would be a way to bring accountability to the folks who are causing harm through their policies, through their lack of inaction, through not paying people a decent wage, for example. Um, and that I do believe that public safety is broader than, the concept of crime or harm, that public safety is really about um, creating a culture and a dynamic where it's it's a little bit of that Jane Jacobs kind of eyes on the streets dynamic, where even before harms are happening, we have a community where people are looking out for each other.
Mhm.
And so some of the things that we have done to try to shift the dynamic about how people think about public safety is every year we've done an event that we call Night Out for Safety and Liberation. And it is sort of a remix of this event that's been traditionally called National Night Out. It started in the 80s, and I think it has a good spirit behind it. It is community members coming out to reclaim community safety, and they do block parties. Unfortunately, I think the vision behind it has been clouded by this kind of framework of fear, where oftentimes police officers come out and they say, "You're the eyes and ears of the police, and if you see something, say something."
Mhm.
And if you think of public safety as the body, a body has more than eyes and ears. A body has heart, we have hands, we have minds, and all of those things are actually necessary to contribute to community safety. So when you offer a hand to someone who's been formerly incarcerated in the form of a job, or when you mentor someone and use your brain power to help them advance their skills as a young person, when we do these things, we are actually contributing to community safety, right? And this idea that we can get to community safety just by being hyper vigilant is actually false, right? And I think if you talk to progressive police chiefs, they will tell you we can't arrest our way out of these problems, right? And if you look in communities that are more homogeneous, I look at Burlington, Vermont, for example, where the police chief was counseling the hospital system on how to deal with overdoses, right? So he's like, no, 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 we don't want you to just bring them back to us. Here's what we're hoping. Here's what because that police chief could see his own family members in the folks who were suffering
Yeah.
from opioid addiction, right? And so we have this challenge where we have to understand that we can't think of taking care of public safety if we haven't taken care of the public. But also we have to understand that all of us are part of that public, right? And so it's a two-part strategy to really get to public safety. One, understanding that it is going to involve challenging, patriarchal ideas that we fund the military and we fund the guns and we fund the things that are associated with masculinity. We don't fund healthcare. We don't fund education. We don't fund the things that are associated with taking care of each other. And I think we can do better.
Well, listen, we are at time in terms of sort of moving to the second piece of our afternoon. So I just want to thank you again. There are other questions which we won't get to in a live sense, and there are also spontaneous outpourings of appreciation and gratitude for your remarks, frankly. So
Yeah.
you should we'll find a way to send them your way. But I just want you to know that it's what I'm seeing also.
Right on.
Yeah,
Can
go
I just
ahead.
say one,
Yeah,
30
please.
seconds? There was a question about how we connect folks to services. So one thing I wanted to name about Restore Oakland really briefly is, as someone has had that aha moment about the harm that they have caused and they want to make amends, sometimes they may still be in the same economic situation that led them to commit an economic crime. And so some of what we're doing with Restore Oakland is then trying to connect people to economic opportunity, to housing supports, and other things happening in that building. And then that way really trying to practice transformative justice, not just restoring people to the state that they were before that maybe was unjust to begin with, but really trying to transform the dynamic. So thank you for that question. And thank you all so much for your time.
All right. Well, thank you very
Yes,
much.
thank you, Mark. Appreciate it.
Thanks. Okay, and we're now going to switch over. I'm going to pass the mic to my colleague, Dr. Joe Ravenel. As I mentioned, a faculty member in our Department of Population Health here at NYU Langone Health and Associate Dean for Diversity Affairs and Inclusion. And he will introduce our panelists. So I'm going to turn the proceedings over to you, Dr. Ravenel.
Hello, everyone. I'm Dr. Joe Ravenel, Associate Dean for Diversity and Inclusion here at NYU School of Medicine. I'm having some technical difficulties, so please excuse the annoying green screen behind me. I'll try to get that taken care of. So thank you, Dr. Gurevich, for the introduction. And to Zach Norris, thank you so much for that incredible keynote address. It's my great pleasure to host, to moderate this second part of today's session. And I'd like to introduce two esteemed guests that we have for the next hour or so to shed some light and provide insights on social movements and social connectedness. I'm going to start by introducing Esmeralda Simmons, Esquire. She is currently retired, but she is the founder of the Center for Law and Social Justice at Medgar Evers College, Center for Law and Social Justice. We invited Esmeralda as Esmeralda as a panelist because of her long and celebrated career as an activist and leader in social justice movements and community-based legal advocacy. She's a civil rights and human rights attorney. She was the founding executive director of the Center for Law and Social Justice in Brooklyn. And she led that organization for 34 years and only recently retired. During her career, Esmeralda served as the first deputy commissioner for human rights for New York State and as a civil rights attorney for the U.S. Department of Education, a New York State Assistant Attorney General, a New York City Assistant Corporation Counsel, and as a law clerk to a federal judge. In addition, she has served on several major public boards in New York City government, including the New York City Board of Education and the New York City Districting Commission. And she strongly believes in community service and has a history of activism in progressive political movements and electoral politics. She resides in Bedford-Stuyvesant, Brooklyn, with her husband and is the mother of 2 sons and a grandmother of 7. Thank you for joining us, Esmeralda.
Great to be here.
Thank you. Our second guest who will be participating in this panel is Afia Atta-Mensah, Esquire. She's the executive director of Community Voices Heard. And we invited Afia as a panelist because her work focuses on addressing community need and solutions through a collective perspective. She joined the Community Voices Heard team in September of 2016 as the executive director after first serving on the Community Voices Heard board. Community Voices Heard is a member-led multiracial organization principally comprised of women of color and low-income families in New York State. They tackle tough issues and build power to secure racial, social, and economic justice for all New Yorkers. Afia has worked in many settings, from Ghana, West Africa, to the urban centers across America to improve the quality and quantity of fair and equitable housing, defend racial and social justice initiatives, and galvanize support for programs benefiting low-income families. She was awarded the Fulbright Fellowship in support of her work at the International Federation of Women Attorneys, advocating on behalf of indigent women in Ghana. Afia and her husband are proud residents of Central Harlem, and she's the mother of 2 children and holds a law degree from Fordham University School of Law and a bachelor's in sociology and Africana studies from Trinity College. Welcome, Esmeralda and Afia.
Hi, Dr.
So
Ravenel.
I would
Pleasure to be with you
thank you.
today. It's Afia.
All right.
It's Afia, thank you.
Terrific. So I would like to begin by giving you an opportunity to talk a little bit about the journey that brought you into becoming social activist leaders. So we can start with Esmeralda.
Okay, so sure. My road is pretty simple. I went from, my family are Caribbean immigrants from St. Croix. And they have, from St. Croix to New York City. And they've had a pretty typical new immigrant experience. My mother, however, was raised in New York City for most of her life. So as a child of immigrants who were striving, West Indian immigrants who were striving, we went from living in, some people might think this is funny, the safety and the bosom of a New York City housing project in Brooklyn, which now is known, of course, for being full of crime and everything else, but it was full of love when I was there, to integrating a community only about 5 miles south, not even 5 miles south, in what was then called Crown Heights, South Crown Heights. And as a child that integrated my grammar school, my high school, and even college, it became my life's experience was dealing with racial injustice, dealing with systemic racism, dealing with prejudice and violence, being chased by boys going home for lunch. And being called the N-word, etc. And of course, I would go home and say, "What is that? What is the N-word?" No, I didn't say the N-word. I said the word. And they said, "Where did you hear that?" And knowing that there was something substantially wrong with the society, notwithstanding the fact that I excelled academically, even with one of my siblings excelled much even greater than I did, and even the grammar school was trying to prevent her from being a valedictorian because she was Black. There was only like 5 of us in the whole school of about 600 students. So that this is a Catholic school, by the way. That was a very typical situation that we lived in. And while my parents encouraged us, they really didn't experience it the way we experienced it growing up. So I think my becoming a racial justice attorney was just a natural outgrowth of the life I led as a youth and as a young adult, and my student activism when I was a student at Hunter, part of the student movement and the anti-Vietnam War era. I believe in my people. I believe in us, I trust us, and I want us to have freedom in this country and to be self-determining around the globe. And saying that is almost like a statement that you don't hear very often anymore, because many of our people have actually given up hope. They don't think we can have freedom. They don't think that we can have a society in which we are safe. They don't feel socially connected to the broader society, and many of them don't feel socially connected to even their own people. Some of them don't feel socially connected to their own families. Our societies have broken down in part due to government interaction and in large part due to poverty and economic situation of the country. So I went ahead and became a civil rights attorney, not because I thought that was going to solve all of our woes, but I thought it would be a good way to be an advocate for what we needed to get done. And while I have retired from Medgar Evers College and the Center for Law and Social Justice, and anyone can tell that knows me can tell you, I am actually very, very busy working with other community organizations now, and have a greater freedom than I had when I was working in a nonprofit. You can say whatever you want to say. I'm not applying for any grants. I don't need any of that. I'm just doing the work and loving every minute of it. Because it's with younger people who have a vision. They're the ones out in the street now. They want to know a way forward. They want to envision a way forward. And as an elder now, I want to make sure I share with them what I know and the things that I have learned. And the one thing that I know has to happen is that we have to come back together as people, and we have to build up our community institutions. We need social connectedness.
Thank you so much, Esmeralda.
You're welcome.
Afia, and can you tell me if I'm pronouncing your name correctly?
Sure, Afia. So think of the
Afia.
U as an I, Afia.
Okay, thank you very much,
No
Afia.
problem. Save that, Doctor.
Would you mind telling us about your journey into becoming a social activist leader?
Sure, thank you. And so I just want to just take a quick moment to thank the team at NYU for thinking of having myself on this panel. And it's been a privilege to serve on a panel with esteemed folks like Esmeralda, and I'm happy to be able to take some time to talk with you all this afternoon.
We do this all the time, folks. It's a tag team, okay? Hi, Afia.
Right. So I'll say for me, my journey has some similar notes as Esmeralda's. I'm a first generation. My father's from Ghana, West Africa. My mom is Antiguan, but grew up in Harlem, right on 143rd between Lenox and 7th Avenue. And my sister and I had the great privilege of living pretty middle class lifestyle. As the kid of immigrants, particularly African immigrants, there is a wholesale premium put on school. Like you could have severed a limb, they will take that puppy back on and send you right back to school.
Oh yeah, please.
Heavy. But even in the midst of a supportive, loving family, right? You're Black in America. We had family members who were close to us who suffered from what we properly refer to now as the disease of addiction. And so early on, my memories were in regards to inequities in dealing with the immigration system, right? From as a kid, what it takes to actually get family members to be able to come and see family, particularly from an African nation, or I know same for Caribbean countries, the hurdles that you have to face to get that visa. And my engagements left me wanting to be an attorney, right? Court has changed somewhat, but not too much from when I was coming up, where a lot of times while the litigants, particularly in the lower level courts, were Black and brown, the folks with power in the court system outside of the clerks and the court attorneys were by and large white, right? Like the CO, the court officers and the clerks, people of color, but the other power infrastructures were, and to a large part now remain, white. And so I was, also say equally blessed to start my legal career at the Legal Aid Society, right? I got into the bosom of some amazing litigators who were just, bare knuckle type fighting type litigators that you would want in your corner, and learn from some amazing folks like Magda Rosa Rios, Cheryl Karp, Judith Goldner, Marie Richardson has always been my rabbi. But even in the midst of that, learning and initially loving taking part in the court system, particularly I came out pretty young, so this idea of a 24-year-old Black woman who was able to represent people who look like me was at the time everything I wanted. But the war wounds of the court system are easily apparent. And I'm thinking about the New York Times article that just came out yesterday, kind of talking about this updated report on race and racism within the court systems in New York. And I dealt with some things that so many of my colleagues did as a Black attorney, right? Always having to show your ID to confirm that you were an attorney. Having to, doesn't matter that you're in a full suit with a briefcase coming to the, right? If you're sitting in the attorney, why are you sitting there? The defendant's somewhere else. This is for attorneys. And it just was clear that the wear and tear of what it takes to be able to fight uphill, it didn't fit me as well after a couple years, right? That wore off, that idea of being a trench fighter while I still believed in it. As my analysis deepened, I was clear that I came into the court system seeking nothing less than liberation for Black people. And as my analysis deepened, I got clear that there was no liberation for Black people in an apartheid court system. So if that's my analysis, what am I doing here, right? And at the same time, I was coming into contact with people in community-based organizations like Community Voices Heard, and had an amazing meeting with a woman who brought me into the organization, Ann Bragg, God rest her soul, who, when she talked to me about CVH, I remember being in this meeting and just being so awestruck and inspired by the way the pedagogy, right, the way they carried themselves of being a community-based organization. And I ran over after, said, what is the CVH? Like, what, is there a newsletter? Like, how do I learn more about this? And Ann looked at me and said, we are not a service organization. We build power and we're here to build it for ourselves. And that was so attractive to me, right? It was almost antithetical to what I had learned or been dealing with as defense counsel, right? Doing cases for tenant and tenant associations where you're, by the nature, right, reacting in a defensive posture. So the idea of being proactive, of being unapologetic about building power, about not just seeking the loaf of bread, and God bless those who give the bread, but asking the quintessential question of like, why do we have to be in this bread line in the first place, right? And moving folks to action to not just bear witness to that, but to challenge it was amazing to me, those prospects. So, you know, I was able to build more with them and as it noted in my bio, joined the board and was coming to a point in my life of introspection. I had my oldest child at the time was 2 and knew that I didn't want to practice in the traditional way anymore, right? I consider myself a pretty jovial person, but the dregs of it sometimes, what you have to deal with in court, it just wore on me, right? And as I said, it didn't fit me the same anymore. Coming home angry, getting up angry, right? Like, even when you get into the courtroom, the niceties ticked me off. Like, morning, counsel, what do we, like, let's not do this. You trying to hurt my client, so let's not even play this game. like, you know, so it was, I didn't like it. And so long story short, my predecessor at the organization was leaving and the members just propositioned me, right? If, right, a good, what we call in the organizing world, an agitation. If you so deeply believe in liberation of Black and brown people, and we agree with you that it's not gonna come out of a courtroom, right? This was before the advent of some amazing work by like the Black Public Defenders Association and others. You know, they also called the question, sis, you could get to call yourself a freedom fighter if you're in the wrong room, right? So come to the right room with us and be with us and let's do this together. And so I'd say that that's kind of what moved me to where I am now, to see that, you know, I still believe that the law is an important tool, but I believe firmly that there's nothing nice about change, right? It's not going to come because we argued articulately. It's not going to come because we wrote a respectable letter. It's going to come, history has shown, and it continues to be true, by a lot of people taking in the streets and being less than nice, being clear, right? Taking movement together in love to change things. But so it moved me to change and to hop on board at a hell of a time, right? I started in September of 2016, and we all know what's been happening from there. So that's a little bit of what brought me to where I am now.
Thank you, Afia. Were both of you able to be on for Zach's talk?
Oh yes,
Terrific.
very inspiring young brother. Very inspiring. I particularly liked the fact that he was connecting all the social connectors in terms of health and the justice system, so to speak, or the unjustice system. You know, climate change, and that we are all connected. So very inspiring, and certainly the examples he gave are the examples that we need to be replicating, and there are some replications here in New York City of the same stuff that's going on there. But prime example, you know, Ella Baker Center has always been a great organization.
Yes, terrific.
I was privileged to be able to catch some of the remarks and just really appreciated the intersectional analysis and lens that he used, and no, it's great.
Excellent. Yes, and so both of you read my mind. I was going to ask you. I was going to ask each of you what struck you most about Zach's talk, but I think both of you just spoke to that.
Oh, I have something else to say about that.
Oh, okay.
His age. His age. That's the most remarkable thing. The wisdom that he has about community organization and community institution building at his age usually takes 40 years.
Wow.
So, you know, He didn't get that at Harvard, okay? He got that straight out of Oakland. It's a really inspirational.
Terrific, terrific. Anything that you wanted to add, Fia?
No, I think Esmeralda caught it.
All right.
Right up.
Terrific. So I actually wanted to go a little bit more into something specific that Zach mentioned, which was this framework of fear that has grown within our country, and he talked about the importance of a path for America to move from an us versus them mentality towards a culture of care. So what are some ways that you see today's social movement as being part of building social connectedness and this culture of care?
Well, first of all, I praise all who are involved in the current social movement, and I'm meeting more and more people who are willing to say, not just be out in the street, but willing to do the work in the evenings and the weekends to build movement. And you know, Zach's take on how we can go from fear to care was excellent. But I want to emphasize the fact that he said it in the beginning, that this is not something new in this country. The country was founded on fear. The country was founded on violence. The country was founded on inequity. So this is not bringing the country back. This is actually trying to establish a new dynamic, a new social connectedness. And while many people are now looking at white privilege, and many people are now looking at really examining what is systemic racism, it's going to be, people don't like the word, but it's going to be revolutionary to move this country from where from its beginning and what has enabled it to go forward by stealing people's land and killing people. And that's a social justice issue, and it's certainly a social connected issue. And what has empowered and actually emboldened people is the state killings, the police killings, and seeing it. It's nothing new in New York. It's nothing new in Virginia. It's nothing new in California. It's been going on forever. But I'm delighted to see people being activated and horrified by it. And I'm delighted to see people of all races joining together and saying we have to stop this. But we have to understand we are talking about some major, major work, but where people are willing to do it. And I'm happy for that.
Yeah, and I would just add similarly, what struck me is that this same thing, that this is the ongoing, this idea of fear and this culture of fear in this nation. And I think it's important to, when we unpack it all, right? Like this culture of fear has only served a very few in this nation, right? We could argue it's never served Black people. It's never served communities of color. It doesn't serve Indigenous people. By and large, it doesn't serve women. It hasn't served LGBTQ and trans communities. So it only serves a subset, right, of all powerful few and some now more and more growing corporations. And so this idea of a scarcity mindset, right, there's just a finite pot and we must all fight to the death to get it, kind of is another aspect of this moving from fear, right? And for me, the way I've always learned and been told is this idea of fear has been used against Black people, both to oppress us by law, to oppress us with murder, right, with actions either by the state or sanctioned by the state. And when we see this, it continues to, I'd say, unfairly force Black, Indigenous, and communities of color to have to not showcase, but put on full display so that others can bear witness kind of the treachery that is happening, right? And we can make it, I think, analogous to Emmett Till's mother, right? Having a casket, to the sorrow and great pain of the mothers of the movement, right? Like Trayvon Martin's mom and George Floyd's family and so many others, right, who have had to kind of retell this story that if you hang us, we'll die. If you shoot us, we will, right? Like this ongoing story, and having to really showcase in a way that no other communities in this nation have about what it looks like when the state murders people without regard, or when the state allows it to happen. So I would say a de facto state sanctioning of murder and oppression of Black people. And so this dismantling of fear and scarcity, the opposite of that is love, right? And so it's hard for folks to understand how taking to the streets at times can be in love, right? The idea that I first got back to, that there's nothing nice about real change, right? I know people like to sanitize things after the fact, that so that we can continue to put Dr. King up on weekends and not talk fully about Ella Baker and her genius, and not talk about sisters like—
And how she was beaten down.
Yep. Right, like is this like even with the passing of Brother John Lewis, right? Everybody likes to talk about good trouble, but when he was in jail, wasn't seen as that good, right? So we have to really understand that to move in love takes strong, bold action. It takes making it so that people are unable to enjoy their homes, right? And we think about civil disobedience in the streets, either for this issues of killing, but so many other things. When we think of connectedness of housing, access to health care, right? It requires people to take bold action, to make people who have been comfortable for far too long and benefited from this fear narrative to suddenly start to feel afraid themselves. Because if we're honest, the purveyors of this narrative aren't really that scared, right? They're clear that they're using what they're using this for and how they're using it. And I would argue we've seen this continue to build up in our body politic, right? That's kind of how folks have been able to when we hear from President Trump now, right? I'm protecting the suburbs, right? It's kind of old school language that's being reused again. So many of these things are being recycled for fear. This to Esmeralda's point, how the country was kind of moved and founded on this fear of the other, which is usually 9 times out of 10 played out of this fear of Black people, this fear of Indigenous people, this fear of communities of color who we must protect from, this idea of white supremacy from. And so I think what's exciting about this conversation and the theme of connectedness is it's harder to hold true to that if you're connected to people. That doesn't mean you like them, right? Or you love them, but it's harder to have these larger narratives if you're connected to other folks. If it's not just othering based on what I saw on Twitter or based on what I heard from someone or other types of propaganda. Because when you're connected, then you have the opportunity to see there may be some, to that point, connective tissue. Oh, you're also struggling with childcare in the midst of COVID. Or you're also, you have asthma too. We're both concerned about it, right? It's harder to say that somebody, this other alien being, when you're sitting right there next to them dealing and grappling with some of the same issues. So it's, optimism, it gets me through. So I like to think if this is not a time where we're really coming together to think about how to challenge this fear narrative and ask who benefits from this ongoing narrative. Do you really benefit from this? Are your suburbs any safer? Is your wallet any fatter? Are your kids getting any better education, right? Like, who is benefiting from this narrative that is keeping some folks prone and always under attack, and others, I'd say, debilitating under that fear. And I'm looking forward to hopefully this being the season where we get to unpack and really challenge that.
Wow. Thank you both. You both referenced examples of trauma and violence, and I think both have historically and currently worked with communities that feel disempowered for good reason. And you talked earlier about Afia, how you were drawn to your organization because they were really looking to build power. And so in thinking about our communities that feel disempowered, how do you begin?
Oh no, oh no. You're frozen. Well, I don't know if they could hear me, but I'll start to fill in.
Yeah, we hear
because-
you. You're
Okay,
good.
great.
Joe's frozen up, I guess, but maybe you can probably anticipate where he was going.
Yes.
Okay. Okay.
Yeah. Yeah. How can we move towards social connectedness? How can we uh, deal with some of the despair, righteous despair that walks the streets of our city and lives on the streets of our city to a large part? And I think that just like the theme of this conference is social connectedness, that we have to get down to the hard work that Afia was talking about. This is hard work. This is working, as I said, evenings and weekends. I'm gonna give a little example. A colleague of mine said, "How did you get so much done when you were raising 2 children?" I said, "Oh, I worked as a volunteer attorney, or 3 evenings out of the weekend, every weekend. I took every summer off and worked as a volunteer." And I said, because I was trying to build power with these organizations, trying to build and by power I mean a place where people can make their own decisions, can self-determine. And we need much more people volunteering within their own communities, in every community of the city, for the better good, for the public health, for the public well-being. I mean, we have a plethora of needs, but we also have enormous number of people in this city. Now, some people can't volunteer because they're working 4 jobs, but those of us that are not working 4 jobs really need to start giving. And I don't believe in that word giving back. That phrase really annoys me. You can't be giving back if you're living in the middle of it. You live in New York City. What back? Where's the back? You're giving, give where you are, and I mean of your time and your expertise, of your skills. It's good people to work in soup kitchen, but if you're a physician, I really want you working in a health care facility. If you're a teacher, it's better if you're working, in an after-school program, teaching the students who are not getting by with virtual teaching. And I also want to say that social connectiveness means connecting as you are doing right now. So I applaud Langone. I'm not pronouncing that right. Langone. As you bringing institutions together, bringing government in with community institutions, bringing academia in with neighborhood institutions, so that people are talking to each other across sectors. And not everybody has to be in health, not everybody has to be in law, not everybody needs to be in education. We need everybody to put their hands in this bucket and start working, because this society is truly having an unraveling moment as people really take a good look at what it really is, and it's shocking people. The fact that we know that police violence is a social health issue, we know that the lack of PPE in prisons is a social health issue. We know that there is no such thing as a China virus, or Chinese virus. We are the ones that have to speak to these things, but we also have to build community. We have to build institutions from the ground up.
Thank you so much.
Welcome back,
Oh,
Dr.
yay, you're
Sorry.
back.
I'm so sorry. Thank you for stepping in, Dr. Gurevich. Were you both able to answer the prior question?
I'll hop in as Esmeralda gave an answer. It's good to see you back. It has happened to all of us. We know
Exactly.
Ordinary times. Listen.
Thank you.
So I'll build a bit on what Esmeralda laid the groundwork for, right? With the admittance that I'm biased, right? I'm in an organization, so I believe people should come into organizations and institutions.
Yes.
But there's a host of ways to do that, right? There's faith-based institutions. A lot of faith leaders are really thinking through critically about what it means to have faith in action, and what that means, how they can use it. And so many of our institutions are under attack because of this culture of fear. So people who are in labor unions, how can you get in deeper in the organizations and the connections you're already in, right? Are there things you can be doing in your labor union, within your family unit? I know we have people from all over, but in this great city of ours in New York City, each borough has numerous community-based organizations. I encourage and invite people to reach out, and to just, in doing that, to come with, I like to say, a sense of humility and humor, right? To first engage and learn and ask what's needed, as opposed to maybe moving on to this is what needs to be done. A lot of times folks have been on the ground working and thinking through. Doesn't mean it can't be better or stronger, but I just encourage people to, when they're reaching out, to kind of go with that mindset of what can you learn, and then to work with the people in those organizations and those members to kind of roll up your sleeves and think through the best use of your skill set. And I think what I loved, Esmeralda, you were starting with is, I think a lot of times what I really appreciated about our previous speakers' framing was both the intersection, but also the way he talked about using a restorative, right?
Right, exactly. Right.
But I think it's so important because a lot of times when I hear the conversation is like, how can we do, fragile communities or communities that are most in need, without a real understanding that none of this is by happenstance, right? These communities were targeted, right? It's not that Black communities, Indigenous, and communities of color are weaker. They have been targeted, right? Have been purposefully harmed, purposely destigmatized. So we're clear about that, not just being rhetoric, but like actual fact that's both historical and current happening. I think it leads us to a logical understanding of a restorative. How can we restore things that were targeted and taken away? And how can we move with that in love? So coming into these institutions and organizations seeking to how do we restore, how do we put back what was dissected and taken away? And how can we do that, not because I want to help others. I think what's really important is to have a internal analysis and a moment of honesty and clarity with yourself of what is your benefit. It's okay to benefit from a just world, right? It's not like, how can I help the downtrodden? How can I, no, what is your investment?
Right.
If there wasn't a scarcity mindset, what if as a nation we believe that people should have health? I'm just going to talk crazy on a Tuesday. What if we believe people should have health? What if we believe that there should be
health care, right?
What if people who are hungry should get, wait for it, food? What if there should be affordable housing? So if we were based on a society that was about not a scarcity mindset in one of the richest nations in the history of the world, if we believe that you had a right to it, right? How would that benefit your life as a middle class white person, as an upper middle class Latinx, as a poor Caribbean, right? How does that make your life better if we were able to push past this fear culture and move from a scarcity to one of care, to connectiveness, to love, to giving, to abundance, to learning, right? You have a self-interest in that. It is okay to say that. And I think people move differently when they see their self-interest than I'm coming to help others. You are, but you're also helping yourself if we have this type.
Thank
right?
you.
So move with that type of deliberate speed, that type of energy and emotion and commitment. So it's not just a moment of guilt or something I should do right now, but if you see your investment, then I believe that person is in for the long haul. And what we need in this road to liberation are people who are in for the long haul. We don't need no allies.
Thank you.
Willing co-conspirators who are ready to restore what was ripped away from us.
Wow.
Amen.
Amen. Exactly. Preach. So I have two questions. The first is, and these are from the chat box. We have increasing evidence that feeling connected reduces mortality and risk of other poor health outcomes. Can you each talk personally about how you think getting involved in social movements impacts one's individual health and well-being?
I can speak to that personally. At one point, not too long ago, people asked me how I could be so happy and joyous and have so much energy. And I told them it's because I work with people and we're all working together for a goal. And I work in my community with people that I believe in and that believe in me and my family. It has made my life much longer, than my family history for you medical folks. And my sister reminds me every day, I'm the oldest living member of my family at this point. And I'm beyond the average, okay? I'm beyond now. And I'm gonna go a lot longer too, because doing what you believe in, not helping. It's not helping. It's working for others and working for yourself as part of a group gives you community, and that's what humans need. Just right up there with food, shelter, and clothing and healthcare. That's what we need. We need connectedness. We need to feel that we belong somewhere and that we're doing something that makes a difference in the world and has purpose. And if this is not your job, if this is your civic activity, or this is your volunteer activity, or this is your community organization, that could be what gets you up in the morning.
Mm-hmm. Mm-hmm.
I mean, I know I have a lot of professional friends that are really very depressed because they've gone their whole life, they've done everything they thought they need to do, and now what, you know? And so I get them to do volunteer work. And now they're like, yeah, when are we meeting again, you know? It's life-giving. It's life-giving. Thank you for that question.
Yes.
Yeah,
Thank
I
you
mean,
for
just the idea, the point of like human beings being made to actually have some folks with them, right? Being in relationship. And clearly I defer on the medical to esteemed doctors and the members of the health community. But my anecdotal assessments are that when people are in relationship, when they're with other people, you just feel better. And even on the hard things, right? I find that one of the most freeing moments that I hear people talk about when they come into organizations and talk through tough issues is knowing that you're not the only one.
Mm-hmm.
You also have someone in your family,
Mm-hmm.
right, who suffers from the disease of addiction. Your child is also going through depression. You're also having a hard time with school, right? Like that you can be in community with people, that you can learn together, support one another, is just huge. And I think part of what comes with fear, right, that's culture of fear that I keep harking back to, is people are scared. Mm-hmm. So you're fearful sometimes of your personal safety, but also judgment. What does this mean for me, right? Am I a failed individual? Am I a failed parent? Am I failed in my profession because I'm not doing X, or because I see things as Y, or because this is how it's moving for me? So being able to be with folks to both commiserate, to learn together, to learn you're not the only one who's feeling this way, I think is huge. And it's one of the many devastating things about our current situation with COVID, right? Like even now, panel, right? We're doing this by online platform. And for me, there was nothing better about conferences than, yes, the speakers, but connecting with old colleagues.
People, right?
Yeah, connecting with old colleagues. Let me see what they're doing in California, right? That connectiveness. I haven't seen you in a long time. What's going on? Let's get together. Let's do this and that, which has made things, you know, we do what we need to do to be safe, but it's extremely difficult and hurtful. And then you surprise what people do when they spiral alone. We don't have folks who are able to check on you and electronically or however. So this idea of being together, and that humans need somebody, or, you know, people socialize differently, but you need a team, a crew, someone who are your folks who are who check on you, you're okay, and to be able to go through burdens and talk through things. And I think what's particularly made this moment even more difficult is not being able to mourn jointly, right? So many people, myself, who've lost people, you're trying to do it via Zoom, right? It's this, all these things that we kind of at times take for granted that have been stripped away from us in this time, which I can only imagine makes underlying health conditions even worse, right? How do you go on to get your medication? Do you want to risk it? Is it, all these types of things when you don't have people around you who can do it for you and do it safely. It's something.
Thank you both for answering that question so personally. We have a question from our keynote speaker, which is, how do we actively support a family environment and system that raises healthy young individuals rather than ones dealing with juvenile incarceration?
Yeah. That's That's a very, very difficult point, and thank you for asking that question. Because as we know, the family structure is the historic unit for human development, and family structure meaning parents and siblings, grandparents, cousins, etc. And as African people, I mean all the other cousins, all of the cousins that may not even be blood. How do we deal with restoring that when the economics don't fit anymore, where people are being thrown away, people are being considered throwaways, people as throwaways, because the economy no longer needs them. And the only solution I have to that, and that's a big question, because there is no family if the finances isn't right. If the finances are in the toilet bowl, that can be enough to break up any kind of marriage, any kind of relationship, because people need to feel like they're doing better together than alone. Having said that, I believe the only answer is the same as we started out before. We have to start from the ground up. We have to support families within our own communities by having places they can go when the family is having a hard time, particularly with adolescents, with young people, and they're doing what adolescents do: act up, they act out, they do this, they do that. And in these times of day, that's a very dangerous thing. Acting out might mean joining a gang. Acting out might be, I want to stay at my girlfriend's house, which really is my boyfriend's house, or my, and it's a dangerous situation. So, supporting families that have needs by having community organizations that don't treat them as if they are, I don't know the right term, as if there's something wrong with you and your culture, as if you as the other, as not being part of the major society. And I don't believe in these terms. That's why I'm saying it the way I'm saying it. There's nothing wrong with you. That's the first thing I tell people. There's nothing wrong with you. You are reacting as anyone would be reacting if they were in this situation. So stop thinking that there's something wrong with you, that you have, that our culture, there's something wrong with our culture. There's nothing wrong with our culture. There's something wrong with the circumstances we find ourselves in this country. So bonding together and providing, it's not just services, it's respect and recognition of them as human beings will go a long way. That can be done not just in medical facilities, not just in social justice facilities, not just in educational facilities, but it can also be done in community action orientation organizations like I'm working in and Afia's working, where both of us are advocates. That's a place where people can come and people feel respected and feel whole. And we all have family problems. We all have problems in our community. And those problems can be solved together, and they can be recognized as humans, and resources and places they can go to get help, etc., can be shared. And nobody is looked down upon because they're having this situation go on in their family. And that's, to a large part, what I think needs to happen. But it has to be ground up again. It has to be, I have to have a place where they feel they can be.
Thank you. Thank you.
And I would just...
Thank you, Trevor.
I would just add to that, because I know, I think we're coming to time, that, I agree that family is one of the most important units, right? And I'm talking a larger vision of family than what's traditionally been told to us. We know families look all hosts of ways. That mean family means folks who love and care for you, and there's a shared accountability is how I'll define family. But I'd also say, so if we know that a lot of families are living in difficult or tenuous situations, I think some of the best role that we can do is helping for systems and structures that support rather than, again, target and destabilize, right? So, one of the biggest reasons that children or minors are placed in care is because of unstable and unsafe housing. Right? So there's really a commitment to making sure that folks don't end up being incarcerated, right? Like, housing is a key to that. I think about how most of the folks who are in the health community will engage with children. It's right? In the checkups and those conversations. And clearly, or those annual visits, clearly there's an importance to being a mandated reporter because we don't want children dead. But we're honest, right? And studies show that there's a fine line in how doctors or healthcare professionals engage, particularly with parents of color, right? And deferring almost to assuming something bad and contacting services that often move people to not get services and feel like they're loved and they're in a place, as Esmeralda said, but feel like they're being targeted and under further scrutiny, right? And I think about myself and my sister circle, thinking through how we even see doctor, oh Lord, the baby fell. Can I get something in case someone said something, right? Because we understand that our words are not taken with the same heat in the medical community. Be it we're not, when we're giving birth and dying, because it's assumed that we're either lying about pain or seeking more medication, or as care providers and caregivers when we're coming in with children or teenagers who may present with some things that happen with every parent, to Esmeralda's point, kids who are testing boundaries, right? If they're encouraged to speak to a guidance counselor, is the guidance counselor going to call the police or see that child as one of their children and talk to them? If they speak to a medical provider about questions they may be having, are they going to be, calling Bureau of Child Welfare on their parent, right? And destabilizing and stigmatizing, or having conversations both as a practitioner, but also as a human being in this world who knows that parents go through hellified things. So I think supporting structures that don't destabilize, that don't target and break down communities and families is one of the most important things that we can do as providers of care, as practitioners, to make sure that kids are not moving, particularly Black, Indigenous, and other children of color, into this pipeline that targets our family to incarceration, right? I've often said to people, when people lose housing, when they're evicted, chances are they're not going to the Poconos, right? They're going to a homeless shelter. And they're adding to, right, homeless children in school, which, right, all these things that happen. And so we're clear, Esmeralda and our lawyers are clear of all the legal, right, obligations. But I urge practitioners to start thinking, again, from a restorative, right, public health viewing about what's the joint action you guys can take to better organize legal systems that get in the way of you providing care for your patient and their community, because you know what it is. You guys can tell stories just like Esmeralda and I can, when you've had to make that call and you didn't feel comfortable because you knew that family maybe needed some extra time or medicine, not another social service in their household dictating to them what to do. So I would look forward to co-conspiring with medical care providers and practitioners who share a broader vision of public health that goes beyond checkups to being in communities that are sustainable, resilient, powerful, and have access and are self-determining what their lives should look like.
Afia, Esmeralda, thank you so much. You have several co-conspirators in the audience here. We are so grateful to you for spending these last 2 hours with us. And we definitely look forward to working more with you. And I mean that sincerely. So thank you. I'm going to turn things back over to Dr. Gurevich. But thank you from the bottom of my heart.
Thank you for what you're doing. Keep it up.
Yeah, really just to add my own thanks, like personally, and I think on behalf of all of the participants, to Esmeralda, to Afia, to Joe, to Zach Norris, really just an incredible set of presentations and discussions. I mean, I've done like we've all done lots of these meetings, but I can't actually remember one that had this kind of engagement, and also people just stayed like wrapped really from the beginning to the end, which I think speaks to your power, and frankly to the power of hearing like truth just said directly, like right out there. So so thank you.
You're welcome.
I want to remind people of part 2 of the conference, right? As mentioned, it'll be Monday, November 16th from 1 to 3. We're putting links to register in the Q&A, and we'll send them. So if you don't have that etched in your calendar yet, I invite you to do so now. And the 2 sessions, today's and that one, are really very much linked. I mean, today I think we've thought together about the impact of a climate of fear, and who in our society is truly served by that. So I think when we meet the next time, we'll build on approaches for addressing that as we consider the link between social connectedness and this kind of context of crises that we're in. So sign up now. And, and lastly, I'll just say, think about what we heard today. I mean, it's, I think it's still knitting together for me, but, this is also hard work, but there are ways to join hands in it. And, whether it's in sort of volunteering, joining organizations, initiatives that are pressing for change, to learn, as Afia said, to bring humility and humor, and I think just finding ways, I think we all heard this, of kind of reawakening and channeling hope and shaking the kind of paralysis that comes from the enduring toughness that all these issues can layer on. So, and looking for restorative solutions to justice and in public health. So really a great set of conversations. Here's thanking you again, our presenters, and really wishing everyone a great rest of day with some additional spring in our collective step, I think, as we move forward to working together for change. Thank you very much.